All right, Jim, thanks so much. Thanksgiving inches closer, and we are all getting ready for the dinner of the year. But safety, of course, is always top of mind, especially if there are children who want to help with cooking. Joining us now is Dr. Sivasankar, an emergency pediatric medicine physician at St. David's Children's Hospital, to give us some advice and insight for us. And thank you so much, first of all, for being with us.
Of course. Thank you so much for having me, Jennifer.
Okay, so we've reported extensively on the flu, RSV cases, and I know that you're seeing a lot of those, but you're also seeing injuries this holiday season. What are the most common injuries you're seeing?
Yeah, that's a great question. We do see a lot of kitchen-related accidents. We see some burns. Thanksgiving is the time when families get together. They're playing basketball outside, football outside, weather providing. And we see a lot of those types of injuries too around the holiday season.
Okay, and so what do parents need to know in order to keep their kids safe, especially if their child wants to go in the kitchen and be helpful in cooking something?
Of course, we always want our little helpers around. We want to encourage them to be in the kitchen, but we want to do it safely. I think the big thing that we want to do is making sure that someone always has eyes on that child and making sure they're doing age-appropriate tasks, and then correctly teaching them how to use utensils, making sure that if we're having things on the stove, that we're turning those pot handles towards the back of the burner so they're not reaching up and grabbing something too hot. One of the most common things that we see are burns, and these can be from burns that are on pots that are on the stovetop, but it could also be hot items that are left on the countertop and on the table, including hot teas, hot coffees, those kinds of things. So really being careful of where their hands are and making sure they're not reaching up and grabbing things.
Okay.
That's really important.
So if an injury does occur, God forbid, but if that happens, how do parents treat that? And when do they know, oh, I should take my child to the hospital?
That's a great question. I think first of all, if there's any sort of burn or injury to the face or to the hands, we definitely want to see them in the emergency department that night. The soonest, the better. Otherwise, if it's in other parts of the body, what you can usually do is give your pediatrician's office a call, and their on-call nurse is even on during Thanksgiving, and they can advise you a little bit on some home remedies and things that we can try at home to kind of help that burn until they really need to be seen in the emergency room. Okay. And if they do, they'll let you know at that time.
Yes, absolutely. And then just lastly, what have you been seeing? Like I said, we've reported on the flu, RSV. Is that what you're seeing mostly this month?
Primarily, we're seeing a whole bunch of upper respiratory tract infections.
Okay.
And of course, those under the age of 2 are the most vulnerable. We're encouraging everyone to not forget things like hand hygiene, which is really important in the holidays. If you're sick, to stay home so we're not getting other immunocompromised or vulnerable populations sick. And then of course, getting those flu shots and those COVID boosters and things like that.
Okay, doctor, thank you so much for being with us today.
Of course. Thank you so much for having me.